I think some of us don't know too much about environmental medicine, and so I thought it'd be a wonderful idea for us to just kind of get in here and see what these environmental factors are and how they can affect our health. So I have all these little credentials here about Dr. Bauerschmidt here, but I think we're going to just jump in. He's board certified in emergency medicine. He's an American College for Advancement in Medicine, certified in chelation therapy, which we know about out at the center for sure. And then he's actually been here to the center before at the Riordan Clinic.
Yeah, actually this is where I learned all about vitamin C to begin with about 5 years ago. Can I start now, or do you got
go ahead.
more stuff?
Sure. Welcome to Breakfast with Matt. Thank you. Come on in, Dave.
Actually, it was kind of an interesting story, to me anyway. 25 years I was practicing emergency medicine, very happily, very successfully. And one morning I was coming home from work and had a car accident on I-95, blew out 3 discs in my neck and 2 in my lumbar spine. And being a card-carrying member of the Church of the Medical Orthodoxy, I went to the neurologist, who sent me to the neurosurgeon, who sent me to the physiatrist, who sent me to the anesthesiologist for the epidurals and the trigger point injections, and the long and short-acting narcotics and the muscle relaxants, and the anti-inflammatories, and the steroids, and the sleeping pills, and the antidepressants, and eventually the Provigil so I could stay awake during the day because I was taking all the other stuff. And I was miserable. And then they decided, well, we're going to do a percutaneous disc decompression on you. We're just going to stick a little needle into your back, and we're going to find out if that mimics your pain. And if it does, then we're going to take this radio wave catheter and gently place it, and we're just going to fry the gelatinous portion of the disc, and that's going to make the fibrous portion retract off the nerve, and your pain will be gone. And I did that, and I felt great for a week. And then I started having progressive pain. And it got to the point that I could not get out of a chair by myself. I could not raise my foot 6 inches to step into the shower to wash myself. So they said, well, maybe you ought to be in the hospital. We'll put you on IV morphine and give you some shots of Ativan and little boluses of morphine in between. While they figured out that what I really had was an infection in my disc and my bone. And so there was 6 more weeks of IV vancomycin through a subclavian line because they tried it in my peripheral veins, and they all blew up like crazy because vancomycin is very, very harsh on the system. And when I finished, I was worse off than when I started. And then I ran into a fellow that I'd worked with in the ER who had started an anti-aging practice a little north of me in Delray Beach. And he said, Mike, let me give you some IV vitamin C. I said, Mark, I thought you were a doctor. And he said, I am. What have you got to lose? And so I said, well, you got me on that one, dude. I rolled up my sleeve, and after the 3rd infusion, I remember walking out to the car to open the door, and I realized for the first time in almost 3 years what it was like not to be in constant pain. And so while I still could, I reached into my wallet, I took out my Church of the Medical Orthodoxy card, I tore it up and used it for confetti and said, I've got to find a new way to do this. So I got on the internet and said, IV vitamin C, where do I learn about this stuff? And up popped the Riordan Clinic. And it said, we have this little thing here, you can come spend a week with us and we'll teach you all we know. Well, I could spend 10 years and not learn all they know. But I learned enough that I could start my own practice in Fort Lauderdale. And that's what I've done for the last, this month would have, or last month started 5 years there. But then last fall, I was asked by Dr. Ron to come back and speak at their last IV vitamin C symposium regarding cancer and stress. And when I came back, I was walking around the reflecting pond, and I sat down at the end, and there's the little EWAP stone. Everything always works out perfectly, and I looked up, and there was the pyramid. And I was kind of going, this really feels really nice. And it was a beautiful fall day, of course. And that evening, Donna made an announcement about we're looking for a physician. So I was sitting at the dinner table with her, and I said, well, what's it going to take for you to sell my boat, sell my practice, sell my house, and move from nice sunny South Florida to Wichita, Kansas? And she thought I was kidding. Says, well, we're a 503B or whatever it is thing, you can write it off as a tax deduction. I went, no, don't think so, darling. But at any rate, here I am. So I'm sorry, Matt.
That's good. Well, you know, it's interesting because I guess sometimes I always wonder, he followed the path that many of us have. When we end up on alternative or complementary methods of treatment, it's because you have been almost killed, or at least not fixed, going through all of the paths of traditional medicine here. And so I think that that's really exciting, and it also makes us know that you've walked in many of the people's shoes who come to see you in your clinic. We are so used to being surrounded by toxic chemicals. You open up your kitchen sink and what's in there? Most people, there's a few people in this room probably who are really good, but most of us open up underneath our kitchen sink and it's full of drain cleaners, you know, caustic things that you use to clean, oven cleaners, you know, rug cleaners. Is this what environmental medicine is?
Part of it. I mean, we're basically surrounded by, or we're awash in a sea of chemicals. There's 80,000 plus that are currently registered as being in use. Of the 3,000 that are the high production models, the stuff that's used most every day, pesticides, herbicides, BPAs, plasticizers, things like that, only less than half of them have been checked for their toxicity effects on human beings. It's a huge problem. And, you know, environmental medicine kind of looks at inflammation as a root cause for everything. And how do environmental toxins affect the human body and promote disease? And I don't know how long you want me to talk at a time.
Well, we'll go on here. I'm going to pound on you, so don't worry, you know.
Just remember, when you grill me, I'm better medium rare.
All right. So now, here's what most people say to me, you know. I'm just going to use a little bit, you know. So is it a cumulative thing? Is it a one-time exposure? How do we know, you know, too much is too much? Because, you know, I have people who come in the store and they can't even walk by the Mrs. Meyer's aromatherapy cleaning products because they go, oh, I can't go down that aisle 8 over there because every time I do it, I get lightheaded and I can hardly stand up.
They have serious problems. And the answer isn't, are we toxic? The real question is, how toxic are we? Because we've all been exposed, you know, from childhood on. And the vast majority of the toxins do bioaccumulate. The question is, where do they bioaccumulate at? Heavy metals, you know, lead, mercury, cadmium are the big 3 that I found in most people. Have been there since childhood. I remember my dad I checked my mercury levels and they were sky high, and I says, well, where did this come from? I got thinking, well, my dad, you know, was a heating and air conditioning contractor, and he used to rip the old thermostats off and put them in a bucket in the garage, and we go play with the, you know, bust them open and play with the mercury. Or
we always did.
Yeah.
We did that in school too.
And how many times did you scrape yourself and mom or dad put on mercurochrome or methylate? It's more mercury. How many immunizations have you had? They all had thimerosal. How many silver fillings have you had? More mercury. Anybody interested? The smoking tooth is a really interesting thing. If you have any doubt about the effects of mercury amalgams, just Google the smoking tooth. But they all bioaccumulate. Many of these plasticizers, the pesticides, the herbicides, the fat-soluble stuff typically hangs out in the fat. Have you ever had an issue where you know, you try to lose weight, you lose 10 pounds, you gain 5 of it back, and you felt miserable in between, and that cycle keeps repeating itself? Well, clearly your detoxification pathways in your body haven't been cleared enough that they can allow that dump of the now free solvents or the now free toxins, and they can be solvents, they can be pesticides or herbicides, to be eliminated from the body. And they sit around, make you feel miserable until you put the weight back on, and then they've got a home again. They don't like being homeless any more than we do. So the goal is to open up the pathways, but then you also talked about bioaccumulation, and this is why people have problems walking down the aisles. People that walk down the aisles and they have these odors that get them. These are volatile organic compounds. These are things that take anything that goes from wet to dry quickly. So perfumes, fragrances, paints, lacquers, any of the solvents. These need to be handled by the liver immediately. They don't have any storage place in the body. So if the liver's already said, hey, you know, I've got enough, I can't do anymore, you're going to get sick. And the folks that have that chemical sensitivity to odors have a very high burden, a total body burden of these persistent organic pollutants. They really need to see somebody.
Okay. Interesting, as I was kind of just browsing on the internet for this discussion today, it said 1/3 of the population had liver disease. But that wasn't the people that had like alcohol-induced illness or hepatitis. It was actually from overaccumulation of toxins in their body. Low level is enough to cause liver problems, like elevated liver enzymes and stuff. Would you agree with that?
Well, you know, I'm always leery about what you find on the internet. You know,
It might have been WebMD.
yeah, well, that's very leery about that one. But because there are cumulative effects, and they can be, and there can be a synergistic effect. An example is a study they did on Halloween candy. You know, you got all the different colors. Well, all those different colors usually represent different heavy metals. Red is cadmium. Yellow can be mercury, though not people are putting in mercury. But what they found in rodent studies is that, say, 10 parts per million would cause any given disease in anybody, in any given rat, of any of these individually. So 10 parts per million of mercury, 10 parts per million cadmium, 10 parts per million of lead, any of those individually is going to give you a problem. Well, when you look at what happens when you put 2 or 3 of them together, all of a sudden you only need 1/10 of a part per million to cause that same disease when the 3 of them are hanging together. So all these Skittles and M&Ms and all these different flavored candies you might have been giving out to the kids, actually there's a cumulative toxic effect from that.
Okay. All right, now let's look here. Now, you know, I'm going to say this. We sell cleanses in the store, and I've always been a little skeptical of people taking cleanses. You know, where you take a fiber product and an herbal product that's supposed to locate toxins. You know, like a GPS, and grab them and then soak them up in the fiber and then a laxative to eliminate them from your body. Is it that simple?
Yes and no. I mean, good rice bran fiber will help trap fat-soluble toxins that the body is trying to get rid of, because the body is the body is an ongoing kind of cleansing machine. And I would like to point something out about the liver. The liver is not a detoxification organ. It is a biotransformational organ. It takes something the body can't get rid of and turns it into something the body can get rid of. In that process, it can actually take something that's less toxic and make it more toxic, which is why I'm dead set against any oral estrogens. Even though estrogens, even bioidentical estrogens, when taken orally, they pass through the liver first. Well, the liver's preferential process is to take that estradiol or estrone and convert it into 4-hydroxyestrone, which is highly estrogenic and highly inflammatory, and that, in my mind, is what puts people at risk for the cancers associated with hormone therapy. So the liver is, so if the liver, so the liver is processing this stuff and is trying to do it.
Okay, so now the liver doesn't detox. The skin, is that still an organ of detoxification?
Well, it's an organ of elimination.
Okay.
Okay, and this is, or you know, in environmental medicine, we prefer the term depuration or cleansing as opposed to detox, because detox presumes you're already toxic. You're manifesting the signs of acute toxicity. So short of the woman walking down the aisle that can't walk down the soap aisle here or anywhere else, or can't walk into the garden area at Home Depot or Lowe's, you know, those folks, they really need, they could probably be considered toxic. All the rest of us just need a good cleansing, which takes us back to the original question about cleansing that I kind of skirted around. The bottom line is the liver is trying to dump toxins all the time, and it does so through the bile. Well, these fat-soluble toxins, because of this thing called enterohepatic recirculation, where stuff that gets dumped into the gut can be reabsorbed and passed back through the liver, may not make it all the way out. So doing things like rice bran fiber or rice bran fiber is a really good one. Psyllium husk is a nice one. Activated charcoal. I mean, there's a number of things you can take orally to help trap those so they're not recirculated. But the idea that you're going to take something by mouth, have it absorbed, it's going to seep through the bloodstream and get into the intercellular space and pull the toxins out of the cells and get back into the lymphatics, get dumped back in, forget about it.
Okay, well, now listen, everyone here I'm sure is in denial. You know, you're thinking you're talking about someone else. It's not me, I'm probably not toxic, you know. I eat organic vegetables here. I eat clean meat. I don't eat, you know, antibiotics in my meat or hormones in my meat, you know. So how do you plan as a physician in your new endeavor, plan to determine whether or not people have toxic overload? I mean, you already said we have some kind of toxicity. How do we know how overloaded we are? Is there symptoms we'd know?
Well, you named the premier one, and that's the sensitivity to smell. If you have that, you've got a serious problem. There are other indicators that I use just in a general physical history to kind of say, gee, this person's at risk. One is, how do you respond to caffeine? You know, is this, do you have a cup of coffee in the afternoon, you can't go to sleep at night? Or what about alcohol? You know, 1 or 2 drinks, are you know, putting a lampshade on your head and dancing on the table? Or the next day, you're really paying for it severely? Or conversely, can you drink as much as you want and have literally no effect at all? You know, this tells me whether you're a fast or slow metabolizer, and each of these can be indicative. If you're a woman, have you ever been on birth control pills? How did you respond? Birth control pills are oral estrogens. They got to go through the liver. If you say, oh my God, I put on weight, I was crabby, my breasts were tender, I know your pathways, your methylation pathways are off. And the idea here is, remember, the liver is a 2-phase system. Step 1 is called the cytochrome P450 system, and it takes stuff that the body can excrete and gets it ready to be attached to something the body can excrete, and that's the second pathway. And it has to do with acetylation, methylation, glucuronidation, and the use of glutathione. So if you're one of those people that can drink all you want, so you've got a really fast phase 1, but you don't have much phase 2. So you're paying for it the next day. If you're somebody that has a cup of caffeine lasts a long time, or gee, you know, just give me the baby dose. Doc, if you got to give me a pill, give me the baby dose, and I'm only going to take a piece of that, you got serious phase 1 problems. Your body's not converting it, it's just hanging around your bloodstream forever. So, you know, a lot of it is kind of question is, how severely affected are we? The bottom line is we all could use a good clean out, simply because this stuff, as you talked about already, bioaccumulates. It stores over the course of time. The longer we're alive, the more we accumulate. Now, you want to keep trudging through life with a bigger and bigger sack of toxins. You want to dump it and walk on. You know, I don't want to be burdened by this stuff.
We want to dump it, but we want to make it easy.
Yeah. You Americans. Yeah, and making it easy, it doesn't have to be a horrendous experience, and I try not to make it a horrendous experience. Because the process of cleansing can set up reactions that can make you feel worse before you feel better. My goal is to do it in a way that is gentle enough for your system to tolerate, but still get the job done. So it doesn't have to knock you on your butt to get up off your butt.
So is cleansing like diet, or give us a little hint? Let us peek into the window, you know, here.
You know, from diet, probably one of the best cleansing diets, if you want to go that way, is a raw vegan. But I don't recommend that for the long term. There's a place not far from where I live called the Hippocrates Institute up in Palm Beach County that were, I mean, they were dyed in the wool. They were you'd almost call them food Nazis. I mean, that was like, you do it this way or you don't do it at all. And you will follow my orders and you will do it this way, or we will going to have serious problems with all of you. And most people that went there got results. The problem is they couldn't maintain them over the long term because it's a very difficult lifestyle to manage. You cannot, in the long term, it's difficult to prepare, it's difficult. I mean, you got to spend half your day in the kitchen to prepare your meals doing raw vegan. But that is a good cleanse. So for a short period of time, it ain't bad, because and basically what's happening with the raw vegan diet is you're getting nutrient-dense foods. Well, what are nutrients? Well, this gets into the thing called reduction-oxidation equation. Our body, we're basically just giant walking, talking biochemistry sets. And what makes us walk and talk is the production of energy. Well, how do we produce energy? Well, it's a very simple biochemical phenomenon called reduction-oxidation. Reducing agents can donate an electron. They're also called nutrients or antioxidants. Oxidizing agents need an electron. They're also called toxins or free radicals. In the exchange of that electron, we create the energy molecules of our body: cyclic AMP, ATP, ADP, NADPH, all these things that can fuel our body and let it continue on its metabolic biochemical processes. So what happens is toxins, remember, are over here on the oxidizing side. So if we boost up that nutrient density side, we're going to help get rid of some of these bad guys. And this is how toxicity basically affects us. Under optimum temperature and pressure, which is the chemical term for everything's normal, our body is a perpetual energy machine. But when you introduce toxicity or toxins, you're increasing the oxidative stress in the body. You need more, and these guys don't contribute to that energy production cycle. They're just there using up the antioxidants or nutrients that we need to keep our energy production going, which is why you're toxic. You don't feel good. If you're just overburdened, you may feel, it's just kind of, I'm just getting older, my joints are hurting and they didn't used to, I'm having a little trouble getting up in the morning, it's just getting old. Horse hockey. There is no reason that we can't live as long as we want to, up to 120 years, as healthy as we can be. The choice is kind of up to us. And the more we burden ourselves down with environmental toxins, the shorter our life's going to be, and the more likely we're going to spend the last 8 to 10 years of it in a nursing home drooling on ourselves. I don't want that for me.
Okay, how about one other topic? I don't want it either. I'm not going to have it. One other question. I'm going to open up for the floor in a minute here. But what about stress? We talk about toxins and everything. But is stress toxic to us or not?
Absolutely. Emotional toxins are probably some of the worst. Whenever we walk around with our hand on the fire alarm in the brain, we are raising our cortisol levels, we're raising our norepinephrine, we're raising our fight or flight hormones. When in fight or flight, our blood pressure goes up, our heart rate goes up, our pupils dilate, our blood sugar goes up, our insulin levels go down, we're all set to like, what do I need to do? What do I need to do? Do I need to run or do I need to stand and fight? The more we are in that position, the more energy production we require. The more energy production we require, the more free radicals we are generating. And actually, in terms of practical uses, as I talked last fall at the clinic on emotions and cancer, not only do we know that emotions, negative emotions or emotional stress will accelerate the rate of growth of cancer and the rate of metastasis of cancer. Even the Journal of Oncology outlined how it does it metabolically. Do you think they pay attention to that? No. Yeah. But just the emotional stress components will decrease your natural killer cell activity, which is what you need for defense against invading organisms or invading cancers. It will increase the regulatory T cells, which are the guys that are kind of saying, okay, quiet everything down. So not only have you taken away the cops, you've also put a clamp down on their ability to do their job. And also it will drive cyclic AMP, one of our energy molecules, preferentially into the cancer. On the more local level, it increases the activity of the tissue-associated macrophages, which are the guys that are sitting down there eating away at the borders of the cancer, so that it can locally infiltrate and metastasize. It also increases the angiogenesis factors, which is the new blood vessel formation. So we're getting new blood vessels into the cancer at an increased rate, just from the effect of stress. So yeah, does that, and if it'll do that to cancer, you know it's doing it for heart disease, you know it's doing it for stroke, you know it's doing it, it's damaging the endothelial lining of the cells and making the cholesterol stick. So oxidative stress is just setting us up for bad stuff all the way around, and emotional stress is one of the biggies.
Okay, and you all thought you were so healthy, huh? All right, any questions here?
I was thinking one of the articles that you brought up, the chlorinated water.
Mm-hmm.
You take a hot shower, opens up the pores. Guess what's coming down? Chlorinated water. And then you take a drink to wash your mouth out. Chlorinated water.
Well, here's the question. Why are hot showers and hot baths so refreshing? Anybody? They're very calming. It's very calming, very relaxing. Hot shower, everybody likes a hot shower. You know why? Nope. Nope, because hot water plus the trichloromethanes, the chlorinated water, equals chloroform. Chloroform was removed from the market as an anesthetic because it was, wait for it, toxic to the liver. So everybody just, when you leave here, go over to Lowe's or Home Depot if you don't have them here. Get yourself a chlorine filter for your shower that costs like 12, 14 bucks. And you get a, well, it might be 16 now. I haven't bought one in 4 months. I know the refill cartridges were 9 in Fort Lauderdale. And you just change that every 6 months and you don't worry about it. Your hair will be happier, your skin will be happier, your liver will certainly thank you for it.
But will we be all relaxed after our shower?
Yeah, because you still opened up your capillaries. So.
How about hair coloring? I have an employee who works here.
You have a problem with that?
I don't have hair. Not whatsoever.
Hair coloring is, again, you got to look at it, and anything that you put on your hair, on your face, on your skin, in your mouth, you know, you got to read the labels. And when in doubt, there's a wonderful website, ewg.org. And it stands for Environmental Working Group, and they now have. I'm not fond of their water filtration choices, but they do have a pretty comprehensive cosmetics database that will go through soaps, hair coloring, and things, and tell you what their research has shown in terms of what's safe. You want everything 0 to 2 in terms of toxicity level. Anything greater than that, just don't bother with it. It's just not good for you. One of the problems we now have that we didn't have 30 years ago is pharmaceuticals in the water supply. This is from people flushing their stuff down the toilet. Most water filtration systems will not remove pharmaceuticals because they can't be detected. So they can't measure it, therefore they can't, you know, they can't figure out whether it's being removed or not. The other one that you have to watch with your water filters is fluoride. Now I know there was when there.
We voted no.
You voted no? Oh, thank you, Jesus. I knew you guys are smarter than I looked. Well, that's good because fluoride is one of those things that you can't. It's really difficult to get out of the water system. Even though fluoride, chlorine, and bromine are all in the same, along with iodine, are all in the same family, the halide family. Right. Fluoride particularly is very difficult to get out of the water system. And that's why, you know, you have problems with thyroid and goiter a lot of times because we don't have enough iodine, and we're constantly being bombarded with bromine from the fire retardants and not only in our bedding and our sofas, but also in our computers. The polybrominated hydrocarbons are used as fire retardants in computers, cell phones, laptops, all that stuff, as well as your sofas and bedding, and that will displace iodine from the system. Our diets are generally deficient in iodine to begin with, so we have a higher incidence of functional hypothyroidism. And so it's not just the effects of toxins on our system is just not limited to, oh my God, I'm going to die next week. It's also the little stuff that comes up, like how is our body's response to the chemicals affecting our overall physiologic function? And nowhere is that clearer than with iodine versus chlorine, bromine, and fluorine.
Okay, how about this? I know a lot of people run filters, like air filters in their house. Mm-hmm. I actually love my ozone, filter. Am I poisoning myself?
Yes.
Oh no!
Ozone filters are absolutely toxic.
You're kidding me.
Ozone air filters. Now, we use ozone in functional medicine for certain specific things, like we inject it into joints for arthritis to help rebuild cartilage. It seems to stimulate stem cells. We'll use it in certain IV solutions because it tends to get the job done a little bit better than peroxide. However, ozone inhaled is highly toxic. And the idea here is also what you're doing is basically the same thing as you do with an ionic air filter. All you're doing is putting negative ions in. People love their little salt lamps, and they're wonderful. It's nice. But what happens is it takes the toxins out of the air, they drop to the floor, and as soon as you sweep the floor or mop the floor, they release the toxins again back into the air. So what you want is an air filtration system that has HEPA and activated charcoal. There's a couple of good ones out there. FaustCO.com is one place. It's a small company out of Ohio. They build, they're a little cumbersome, but they're really good. And if you tell them you're my patient, you get 20% discount. I don't get anything, but you guys get 20%. IQ Air is another really good one, and they're a Swedish company, and the Swedes love their clean air. They need to, because they got a lot of stuff hanging around up there. And Blue Air Filter is also a good one. But those are the three that I generally recommend for folks. And then if you are chemically sensitive, then you actually absolutely need to get a personal air filtration that you can wear around your neck and clip to your shirt, and it is just an ionic stream, which will just cleanse the air for about a 3-foot radius around you and just help eliminate ongoing exposure. Because the bottom line of this whole thing is avoidance. The top 3 treatments for ongoing chemical exposures or environmental medicine is avoidance, avoidance, and avoidance. So clean air, clean food, clean water.
Just before you got here, there was an article in the paper that the Kansas government was insisting that your kids get all the vaccinations before they'd be allowed in school. What do you feel about vaccinations, and how can we avoid getting our children vaccinated?
Well, I've got a couple of problems with vaccinations besides the fact they don't work. And if is there a question that polio was controlled by the use of the polio vaccine? Now, there's really no question that was controlled. However, did we really solve the problem? No. Nowhere is that clearer than with the measles vaccine. In the measles vaccine, it's supposed to be 95% effective, which means that if you give 100 people the vaccine, 95% of them are going to be protected against getting the measles. Quebec, Montreal, had an outbreak of measles where 95% of the population was vaccinated with a 95% effective vaccine. 50% of the population got the measles. How did that happen?
It was a different measles.
Maybe. Maybe. The other problem is, where you're measles is really only fatal in the first year of life. Well, if the mother is breastfeeding and she had the measles, she has natural immunity. She confers that on the infant. So the infant is protected that the first year of life, if breastfed, they're protected that first year of life from ever getting the measles. If they get it later, big deal. They may be sick for a few days. Hell, I had the German measles, then I had the rubella right after that. I was back-to-back measles when I was a kid. Sick as a dog for about 10 days, but then I was done. So this whole idea that, and if you do the vaccine, mom doesn't get the measles, but neither is mom protected through natural immunity. Immunizations do not mimic natural immunity. Immunizations are fake and they have to be repeated. The other problem I have with them is looking at flu vaccines in kids. When the flu vaccine, because we predict what strain of the flu is going to come up. Well, in kids that were vaccinated against the predicted flu and the new flu showed up, the kids that weren't vaccinated did better than the kids that were vaccinated. The kids that were vaccinated had a higher death rate and a higher hospitalization rate than the kids who weren't vaccinated, because the body took too long to recognize that something was amiss. So no, I'm not a fan of immunizations, and if there's, you know, vitamin C will cure polio. Dr. Klenner showed that in the 1950s in Reidsville, North Carolina.
How much?
Well, that's the problem, is it took everybody's dose was a little different, but he kept giving it until they got better, and they all got better.
Orally or intravenously?
Yes.
Both?
He used both, and intramuscularly, which I can't imagine that happening, but oh my God.
I've had healthcare providers who were doctors and nurses who shop here, and now they are required through their jobs where they work to get flu shots.
Unless they
So,
wear a mask.
pardon me?
Unless they want to wear a mask from the flu season. They have an out by wearing a mask for like the 5 months.
Really? But anyway, so the question is, the ones who took the flu shot asked me what do they do to protect themselves after they took it.
Pray.
This is true.
Pray a lot. And strengthen the immune system. I mean, ultraviolet blood irradiation is really good for that. You know, just keeping your antioxidant levels up, vitamin A, vitamin E, vitamin C, vitamin D. You know, if you start coming down with an acute viral symptoms, my favorite little recipe is 60,000 of vitamin E twice a day, 800 of vitamin E twice a day, 40,000 of vitamin D twice a day for 3 days only, and all the vitamin C your gut can handle. You do that for 3 days, you feel better, and then you go back to your regular old maintenance doses. Takes care of about everything.
All right, Dr. Mike, I want to make a new start. So what am I supposed to brush my teeth with?
Really good question. I mean, check on ewg.org. You know, fluoride by itself, topically, as a topical treatment, is not going to be a problem. The problem is when you swallow it. So, you know, if you have a fluoride toothpaste you like, you know, you just got to look at the other chemicals. You know, most of the soaps and things, you get into problems with like triclosan and the antibacterial. Be wary of anything that says antibacterial on it, because it's loaded with something you don't want. But you know, baking soda is a nice option.
Okay, I've done that.
Baking soda and purified water as opposed to tap water. Make a little paste out of it.
How about probiotics? You know, will they help with your elimination if you're, you know, trying to detox? If you need to get your gut flora all pepped up? She mentioned yogurt.
Well, and having the right balance of gut flora is extraordinarily important. Not necessarily from, you know, a classic cleansing process, but the gut, you know, if probably 4 to 5 pounds of our body weight is made up of bacteria that live on and in us, and 4 of that 5 pounds is living in our gut. And if we did a cell count of the number of cells in our body and a cell count of the number of bacteria in our body, the bacteria would outnumber us 10 to 1. Having that right balance is very important for our overall nutrition. Having good nutrition is going to give our body the ability to deal with that redox reaction effectively to produce energy efficiently, and therefore it's going to help with with all the body's systems. So yeah, probiotics kind of good for general overall health, but its specific role in a cleansing process really kind of remains to be seen. And one of the analogies that I like to use with new patients is that, you know, what you've come with me today is the equivalent of climbing Mount Everest. And if you really wanted to climb Mount Everest, you get on a plane, you fly to Nepal, and you'd hire a Sherpa. Why? Because the Sherpa knows the equipment you're going to need. He knows where the base camps are. He can get you to the top of the mountain. But there's 2 things he won't do. He won't push you up the mountain, and he won't carry you up the mountain. So I'll be prepared to walk as far up the mountain as you want with you, right by your side, but I'm not carrying you up there. You got to do the heavy lifting.
That's a great way to put it.
Final question, or are we going to thank him?
Let's thank
All right, thank you.
Thank you. Thank you all.
I'm sure he'll hang around a little bit and visit some, so thank you so much for coming, guys.